It started with a declaration on May 15th. By the end of the month, the numbers had tripled. Today, over 500 confirmed cases, 91 deaths, and an outbreak that has already crossed at least one international border. This is the Bundibugyo Ebola outbreak of 2026. And the global health community is racing against a virus it doesn't yet have an approved vaccine for. The epicenter is in Ituri province in the Democratic Republic of the Congo, but the virus has already reached the 25 health zones across the country, some hundreds of miles from where it began. Uganda has confirmed 19 cases, all traced back to cross-border transmission, with 2 confirmed deaths and secondary spread now documented at Ugandan soil. The strain responsible is the Bundibugyo virus, a member of the Ebola family, but less common than the Zaire variant that most people associate with past outbreaks. It originates in fruit bat, spreads through direct contact with infected bodily fluids, and carries an incubation window of up to 3 weeks. That window is precisely what makes containment so difficult. People can travel, cross borders, and interact before they ever show a symptom. Over 5,000 people have already been identified as contacts. At least 16 of those infected are healthcare workers. Here's the critical issue. The 2 approved Ebola vaccines, Ervevo and Zabdino, were designed for a different strain entirely. They target the Zaire virus. Against Bundibugyo, they simply aren't effective enough. 3 candidates are now in development. The most advanced, from IAVI and the University of Texas, has shown protection in primates and could begin human trials within 7 to 9 months. Oxford and the Serum Institute of India are working on a candidate that could enter trials within 2 to 3 months. And Moderna is applying its mRNA platform to the Bundibugyo glycoprotein, though that one remains in preclinical stages. The Coalition for Epidemic Preparedness Innovations has committed up to $62 million to accelerate those candidates. The WHO and Africa CDC are jointly seeking over 500 million more. The CDC projection has warned that without urgent intervention, this outbreak could exceed 20,000 cases within 3 months. This response is moving, but the virus is moving faster. What happens in the next 60 days will determine whether this remains a regional crisis or becomes something far harder to contain.